Late 89 and early 90s, we started the concept of minimal access surgery. That means that instead of making a big cut, you make a couple of tiny punctures.
How much control does a robot have while doing the surgery, and how much control does the surgeon has?
So I think as a surgeon, we have our wrist movement. This is the only limited to very few degrees. Whereas the instruments which we are using in the robotic system have almost 720 degree of movement. So that increases our accuracy. This is what
Dr. Pradeep Chowbey, who is the Group Chairman of Max Healthcare Institute of Robotic, Bariatric and GI Surgery, who started the laparoscopic surgery in 1989. He's the man who brought this kind of idea, which will not help only in the patient safety, but also after the surgery. So if I talk about the 2 pointers which can differentiate between the laparoscopic and the robotic surgery.
Well, the punctures of robotic surgery, they are far less painful because I think there is...
Before choosing the surgery, is it so important to choose the correct surgeon?
This all depends on the experience of the surgeon. Experience will not only reflected while you are operating, but the experience will be reflected who wants to move to robotic. So the day they buy a robotic system and start operating, they have to qualify. So something like if you are driving a car and if you want to fly, you have to have a pilot license. So when you sit on the robotic system, you have to log in your name and there is your password. Once your name is there, you are responsible surgeon.
As you talked about the mechanical or the technical errors, sir. So if such kind of situation happen, what is the backup plan for the doctor?
There are lot many backup plans. I think.
So if I talk about the future, so what do you see the next future of surgery?
Well, I think next future of surgery first will be.
Hello everyone and welcome to a Healthy Talk Show, an initiative by Medgate Today. Today we are with someone who started the laparoscopic surgery in 1989. He's the man who brought this kind of idea, which will not help only in the patient safety, but also after the surgery. I'm talking about none other than Dr. Pradeep Chowbey, sir, who is the Group Chairman of Max Healthcare Institute of Robotic, Bariatric and GI Surgery. Thank you so much, sir, for letting us to host you and decoding all the new advancements which you have seen from the ages and letting our audience know about it.
Sure, thank you so much. It's a great pleasure and privilege for me to be discussing with you regarding some surgical procedures which we started in India more than 36 years back.
So as you have just said that more than 35 to 30 years back, so you have seen the evolution of the surgeries from laparoscopic to the traditional method, now the robotic. What evolution has changed, sir, that nowadays whenever a patient goes to the consultation and he hears that now we will do a robotic surgery, the patient feels like एक surgery room hoga, there will be a patient, a bed and the robot who will be doing the surgery.
True.
So for our audience, I just want to know the very basic of what is robotic surgery, how we do the robotic surgery, or basically OT में होता क्या है?
देखिए, I think I will go back a little more because being a conventional surgeon, in our generation, we have done conventional surgery. So almost about for 15 years, I did the conventional surgery, which used to be, of course, with long incisions. And it used to be a 3-dimensional surgery where you could feel, you can touch the organs and things like that.
Yes.
And late 89 and early 90s, we started the concept of minimal access surgery. That means that instead of making a big cut, you make a couple of tiny punctures, maybe 5 millimeter, 10 millimeter punctures in the abdomen or in the chest or anywhere for that matter.
Yes.
And do the surgical procedures, you know. But yes, I think we had tremendous advantage of minimal scarring. We had tremendous advantage of very minimal discomfort and the pain, early recovery, great cosmetic outcomes. And the patient used to be back in a couple of days back to work.
Yes.
But yes, we do accept that we lost the third dimension because the laparoscopy and those days, now we call it a conventional laparoscopy,
Okay.
is a two-dimensional surgery. As if the surgeon is looking at the mirror and operating.
Yes.
Now, about a couple of years back now, in fact, if you go back in 2000, the intuitive Da Vinci robot got the FDA approval. So it's almost about 26 years the robotic surgery has come.
Yes.
And I think over a period of time, it has evolved. The thing, what we feel very excited is that it has brought the lost dimension to us as a surgeon. So now we have a minimalist car, advantages of all those things. And also, as a surgeon, three-dimensional surgery, which increases the surgeon's accuracy and also precision, and it gives an excellent view. And we all feel as if you're sitting inside the abdomen and operating.
Yeah.
So the precision has really improved with the robotic surgeries.
Yeah. And if I talk about, sir, अगर हमें एक पेशेंट को बताना हो कि रोबोटिक सर्जरी होगी एंड उनके दिमाग में पहले से चल रहा है कि रोबोट होगा जो मेरा एक सर्जरी करेगा. So for our audience, I just want to know how much control does a robot have while doing the surgery and how much control does the surgeon has. या सर्जन ही पूरा क्या बोलते हैं ट्रीटमेंट करता है, सर्जरी करता है, कि रोबोट का उसमें कुछ साथ होता है?
I think ये हमको समझना जरूरी है कि these are slave robots. So, and it's not robot, it's a robotic arms.
Acha.
So I think as a surgeon, as a human being, we have our wrist movement, this is the only limited to very few degrees. Whereas the instruments which we are using in the robotic system have almost 720 degree of movements.
Okay.
They can go 360 twice.
Yeah.
So that increases our accuracy.
Okay.
So this is what, and just imagine a pilot who's flying the aircraft. So we are like pilots sitting on the console. We have got 100% control of each and every instruments. And every movement is done by the surgeon. It is robotic arms will follow your command, what you are doing.
Okay. So the mind will be of the surgeon, and the command, the robotic slave will be just
following my commands of hand movements. So that is one. So, and the surgeon is sitting in the same room.
Acha.
And the team is also by the side of the patient.
Monitoring.
So if there is any issue, the surgeon is already there. So it is not the robot which is operating. It is the surgeon who has got 100% control of the robotic arms, which are doing surgery for the patient.
So basically, it is not a robot. It is just the robotic arms जो सर्जरी करता है, and वो एक तरीके से जो हमारे रिस्ट एंगल जो नेचुरली ह्यूमन का नहीं मूव कर सकता है, उसको थोड़ा एडवांस करता है for the accuracy.
So I think if suppose we want to put any particular thing at a particular angle, if you want to apply or we want to cut something at a particular angle, with the limited movement of the wrist, there may be little, difference.
Yes, exactly.
But with the excellence of the robotic system, the instruments are moving and so much flexible. We are able to do exactly what needs to be done.
Yes.
And of course, today we talk about artificial intelligence. So all AI inputs are going into the robotic system. So which makes us surgeons much more precise, much more confident, much more safe because of the precision and also, of course, three-dimensional movements.
Yes. Sir, आपने लेप्रोस्कोपिक में भी काम कर रखा है, तो लेप्रोस्कोपिक में भी minimally invasive चीजें होती हैं. So what has changed and what has developed कि अब लेप्रोस्कोपिक सर्जरी से पेशेंट्स को most of the time जो सर्जन्स होते हैं रोबोटिक सर्जरी के लिए कंसल्ट करते हैं.
The technology आप देख रहे हैं, technology is improving with such a force and such a speed that we have to keep track of it. We have to be there at the cutting edge. So as I said, laparoscopy being two-dimensional, the instruments are rigid, only the tip is moving.
Yes.
We are moving to the robotic instruments where only tip moves and nothing moves. And my accuracy will be defined by my wrist movements. It's only the wrist which is moving, like you're signing.
Yes.
My elbow is not used, my shoulder is not used, my body is not used. My hand is on the bar, so my everything is frozen. Only I'm moving the wrist.
Okay.
So those movements are far more precise with this. And of course, I can choose where I to make a puncture. With laparoscopy, conventional, so we call it, the punctures are at a fixed points. You can't possibly change them much. But with the robotic gadgets and platforms, we can change the position of the ports, what suits us and for a particular disease. And many times, and I would say most of the times, we are able to put those punctures at a location in the body which can be hidden. Maybe in the undergarments or something like that. So there's practically no visible scar.
Okay.
But of course, I can't say it will happen for 100% patients. In some patients, because of the conditions of the organ inside, we definitely will have to modify, because safety of the patient is
the
of
first
prime
priority.
importance for
Yes.
us.
So if I talk about the 2 pointers which can differentiate between the laparoscopic and the robotic surgery, what
Well, the punctures of robotic surgery, they are far less painful,
Okay.
because I think there is a sweet spot on which we keep, which is calculated by the robotic system, which produces the minimal movement of the skin puncture.
Okay.
So I think that reduces this thing. Another thing is, being a 3-dimensional surgery, we are able to operate quickly. So quickly means lesser anesthesia, lesser medication, lesser painkillers, and of course, excellent cosmetic outcome.
Yeah.
So that is what the huge advantage. And the way technology is moving today, I think we are using Intuitive Da Vinci robotic system, which is almost, I think, 5th generation of the system.
So,
It's like a fifth generation of fighter aircrafts. Now the 6th is coming.
Yes,
It's
exactly.
something like that.
Yeah.
So it's changing every day, and we see every robotic invention is adding to the safety, accuracy for the patient's benefit. So I think bottom line is that for everything, we are talking about the patient's benefit
Yeah.
and excellent clinical outcomes.
Yeah. So if I say one line, how will you decode it? Latest technology means best technology and best patient safety.
Yeah, I think, what is important is for the patient's point of view. First is diagnosis, how it has been diagnosed. Once the diagnosis is there, how we are planning the surgery. What are the pre-operative preparations? Then comes the role of surgery, and that is where the robot plays very crucial and important part. And after all, during that operation, the safety is, I think, the highest with the robotic system.
Yeah.
It's something like a safe car or a safe aircraft. Say, if you're driving a safe car, it is, while the car is standing, its safety is not important. When you're traveling in the car, that is important.
Yes.
So robotic system adds that journey of operation far more safer and more accurate, I would say, and less painful, of course.
Yes. So during the conversation, you said that we see the patient, we see whether the patient will be okay for the robotic surgery or not. So my question is, how do you people decide whether this patient is okay and will be benefited by the robotic surgery, or can we do the procedure of robotic surgery on that patient?
See, many years back, what happened was that people thought that the complex surgeries can be done robotically. Limited space like pelvis for uterus, for urinary bladder, for prostate, because there is a very limited space. So the robotic system used to be of a great advantage. But soon, with the newer generations of robotic system, we realized that we should also give the same advantage to the non-complex cases also.
Yes.
So now the concept is that why should we give something better to some patient and not so good to some patients?
Understood.
So now the concept is that every patient who's getting operated, if the surgeon feels that the robotic system is going to be better and good for the patient, we always offer that robotic option to the patient.
Yeah.
And they have to choose. After all, I will be the same surgeon for laparoscopy. I will be the same surgeon for
The
robotic laparoscopy.
So many patients think like there is when the doctor says to the patient that we will do the robotic surgery, they evaluate through age, weight, anatomy of the patient and all. So I think this is a myth, right? The patient have in their mind. Yeah. So
it's a complex, it's multiple factors which decide.
Okay.
And yes, there may be some situations where we say, okay, I don't think robotic surgery will be a great option for you.
So are there any kind of situation where you say कि आपको जरूरत नहीं है या आपका robotic surgery नहीं हो सकता?
नहीं, generally we don't say. We say the better option will be either a conventional laparoscopy or even open surgery. Sometimes we give them the option that even laparoscopy may not be a good option.
Okay.
And now we have got a fallback option. For example, suppose you start a surgery robotically and you feel that possibly it may not be a good option. Then you can always move on to laparoscopy. If you feel that laparoscopy or you're also finding it difficult, then you can move on to conventional surgery. So when we are doing robotic surgery, we have two fallback options.
Achha.
One is a conventional laparoscopy, another is a conventional open surgery.
Okay. So you have talked about that we use the robotic surgery for the complex cases on the priority. So is there any kind of case in your whole life, sir, that you have done the robotic surgery at such a place that was too complex and was completely under the kind of situation where you will do the robotic surgery is the only option?
Well, I think the biggest advantage will be in the area which has got a limited space. So it could be pelvis or it could be even abdomen. When there are a lot of adhesions all around, there's very little space for us, a small window through which we can enter into the space. There, I think robotic surgery, because it's a three-dimensional surgery and we don't have to make big movements, we have to make small movements.
Yeah.
So, like you burrow it in and go to the gallbladder and you can make a small dissection. You have got a 3D vision, excellent color definition. So with a small tunnel, you can do the same procedure.
Okay. So my next question will be that before choosing the surgery, as you said that you give the option to the patient, it is so important to choose the correct surgeon?
Yeah. It is, again, this all depends on as I said, the experience of the surgeon. So experience will not be only reflected while you are operating, but the experience will be reflected when you see the patient for the first time. First, you see what is the diagnosis and you see what is the best option for the person, whether it is a surgical option or it is a non-surgical option. If it is a surgical option, then you start thinking whether the robotic surgery will be beneficial to that person or not. And now I think another great advancement which has taken place, especially I'm talking about the Da Vinci system, is that it has got practically each and every available modalities, like stapling devices, the diathermy devices, and all cutting and coagulating devices. So it has got almost about 25 instruments which you can choose with.
Wow.
It's a wide range.
Yes.
So you can choose the precise instrument what you want to do.
Exactly. And so when you say to the patient about the robotic surgery, अभी भी क्या लोगों के दिमाग में है कि robotic surgery is not good? आप convince कैसे करते हैं किसी patient को?
See, I think the very interesting thing is बहुत पेशेंट्स मजाक में ही बोलते हैं कि आप तो खुद रोबोट हैं तो आपको रोबोटिक असिस्टेंस की क्या जरूरत है?
Yes.
Then you have to tell them that yes, we do need robotic assistance. We do need artificial intelligence, and we definitely would like to cut down on human errors. And that is what I think is important. So every day, as a surgeon, I would say, if I talk about the robotic surgery, possibly I will say that we are safer with the movements. Something like car. The car used to be without airbags, without power steerings. So those days we used to use that car.
Yes.
But now the safety has come.
Yeah.
So you have got airbags, you have got power brakes, you have got various devices which sort of tell you some objects are coming closer. Those safety features.
Yes.
Because I feel that in life, safety is never enough.
Yes, safety is
So
enough.
today, what we are talking of a safe surgery, tomorrow I may come back and say, yesterday what we talked about a safe surgery,
Yeah.
today we have got a safer surgery.
Yeah, exactly.
So safety is never enough.
Yes. See, you have learned a lot, and the human body is something which is evolving every day. How the doctors cope up with the new advancement which are coming in the healthcare? Because the advancement is not only about the technology, it is about how the doctor is adapting that and making it into the practicality.
Yeah. So it's a very interesting aspect which we are going to touch. Now, with all these digital devices,
Yeah.
the robotic systems, we have got simulators. So, like any pilot who will go through the simulator, various disastrous conditions will be given through the simulator. Something like bleeding, something like you're not able to close that gap. And the surgeon on simulation, he has to do that. And the simulator keeps on giving us marks.
Okay.
Right? So and then there are hours of simulation, then there are marks of simulation. Then we move on to our animal models, where we operate with the same robot on the animals model. We call them patient, of course.
Okay.
For giving the respect to
Yes.
them. So we do that, and then only you get certified.
Okay.
So there's many hours gone on simulation.
Okay.
And then simulation gives you each and every possible disaster which can happen during surgery. The mechanical failure, the robotic failure, the bleeding, and how you have managed that. If you manage that on the simulator, I'm sure you are good enough to manage it in the real situations.
Yes.
Yeah.
As we talked about the mechanical or the technical errors, sir. So if such kind of situation happen, what is the backup plan for the doctor?
There are lot many backup plans. I think within few seconds you can just remove all the robotic arms. You can pull out the instruments. Either you go in for conventional laparoscopy, or if need be, you do the open surgery.
Okay.
Which will happen in any case. So you can't blame the robotic system for that.
Understood.
But as I said, for example, it has got a battery backup, it has got a UPS backup, it has got a power backup. So we have 3 backups because these are all
which is happening in a very critical area.
Critical area.
Yes, exactly.
So we don't compromise with only one backup.
Yes.
We have to have 3 backups before we actually start the surgery.
Understood.
So those are fallback. And then there is expert team. So I would say that robotic team is far more experienced and far more dexterous, far more prepared for the eventualities or unexpected problems. And we feel much more confident with robotic surgeries than even with the conventional surgeries.
As you are saying that the doctors are much confidence for the robotic one. But sir, जब भी हम किसी चीज की बात करते, there must be some risk. There is nothing like 100% safety ही होती है. So is there any kind of risk which can happen while having the procedure of robotic surgery, which the patient should always know before the surgery?
I would say there is no specific risk with the robotic surgery. Any surgery and every surgery had got certain risk factors.
Yes, exactly.
Inherited risk factors.
Acha.
Whether you do conventional surgery or you do a conventional laparoscopy or you do robotic laparoscopy. Apart from that, I don't think there is any specified risk associated with robot system.
And what is the time period? As you said, the robotic surgery has brought up the kind of situation that after the surgery, the patient will be very healthy and will be out of the bed. So what is I will say, the common time period of the post recovery for the patient?
Well, I think most of the patients, if we talk about, say, gallbladder surgery, or we talk about hernia surgery, or we talk about the fundoplications, hiatus hernias, these are the common robotic surgeries which we do. So what happens, many of them, if they are less than 60 years, they are admitted in the morning.
Okay.
By evening, they are moving around.
Wow.
Many of them, maybe 30-40% of these patients will go back home on the same day. At least I would say there is no follow-up for them. After 5 days, they remove their dressings.
Wow.
There are no stitches.
Okay.
They have waterproof dressings.
Very nice.
So next day they eat normal food. They walk as much as they like. They can start driving whenever they feel like. They can join gym. So we don't restrict them. So I think it should not be misunderstood. We as a surgeon do not restrict them for any activity.
Wow.
The patient, his mental status, his body, his age, decides what he wants to do.
Understood. So psychologically, you make them that you are a very healthy person.
Yeah.
You just have gone through some of the procedure.
Yeah.
Apart from that, your body is as healthy as it was when you were before the disease.
Yeah.
Yes.
And please follow your body language. What body tells you to do. Suppose you want to drive the car. You should decide. I will not decide.
Yes.
On the same day you want to drive, it's fine. You can't harm yourself.
It is on the willpower.
And the physical ability of that person.
Yes.
And I think surprisingly, we have seen, maybe for whatever reason, I think some of the patients have driven their car back on the same day.
Wow.
Maybe for some mishap, something happened in the family.
Okay.
And there was nobody. Everybody was there. So the patient himself drove the car to reach to that area. So
understood.
It was a compulsion.
Yes.
But what I'm trying to say is that with that compulsion, the patient who had robotic surgery a couple of hours back could drive his car back home.
Yes. So it is the success.
That was not an option for him.
Yeah.
But it was an emergency for him.
Yeah. So it means it shows that the kind of credibility the robotic surgery is having for the patient is apex. Like they can I will not say blindly, but yes, with the full faith on the surgeon, with the full faith on the technology, the patient can go inside the OT and come with a very healthy body outside. So अगर एक statement दूं सर, उसको आप कितना सही बोलेंगे? I think मुझे तो लग रहा है सही बोलेंगे. That is no pain, no scar, and fast surgery is equal to robotic surgery.
Yeah, I think I would add and modify no pain to discomfort.
Okay.
Not pain, but discomfort.
Okay.
Because these are all punctures. So, जैसे आप कपड़े में सुई डालते हैं.
Yes.
So you are not breaking the fibers.
Yes.
So when we put a puncture in the abdomen, very small puncture, so it separates the muscle. There is no muscle damage. So when you pull out that trocar, then the muscles they come back.
Contract दोबारा हो जाता है.
और जितनी जल्दी वो चलता है, वो उतनी जल्दी वो अपनी जगह पे आ जाता है.
Yes, movement के through.
Yeah, so that is the reason they don't need any rest.
Understood. Sir, हम इतनी टेक्नोलॉजी के बारे में बात कर रहे हैं कि पहले ट्रेडिशनल होता था कन्वेंशन सर्जरी, देन द लेप्रोस्कोपिक, नाउ द रोबोटिक सर्जरी. विद दीज काइंड ऑफ सर्जरीज डेफिनेटली फाइनेंशियल चीजें भी इंक्लूड हुई होंगी. सो आई जस्ट वांट टू नो कि अगर if someone is opting for the robotic surgery, what is the difference in the financial gap between the traditional laparoscopic and the robotic one?
देखिए, फाइनेंशियल चीजें is a different subject. Financially, of course, they are more expensive than the laparoscopic surgery. But आपने और हमने सबने ये देखा है कि जब टेक्नोलॉजी रहती है, टेक्नोलॉजी आती है, शुरू में वो एक्सपेंसिव होती है.
Yes.
But over a period of time, the expense का वो एलिमेंट खत्म हो जाता है. अगर आप देखिए, बहुत सिंपल सा एग्जांपल है. Many of us जब मोबाइल टेलीफोन आया तो we paid 16 rupees per minute
Yes.
for
exactly.
incoming and outgoing calls, right? We all paid for international calls.
Yeah.
But today, what do you see the difference? So initially, we may feel that robotic surgery is more expensive, but I would say it's an investment on your body.
Investment on your body.
If you want to have a good education, probably you will be paying more.
Yes, exactly.
If you want to have a comfortable journey, maybe you will be paying little more.
Yeah. Quality comes with price.
Yes.
Yeah.
Yes. But I'm sure over a period of time, it will be not surprising for us that it will be almost as expensive as the conventional things.
So basically, if I say in one line, that is, patients should not pay for the technology, but they should pay for the better outcomes.
Better clinical outcomes.
Clinical outcomes.
Lesser pain. More of a discomfort.
Yes.
And of course, I would say safety during the procedure.
Understood.
So like you're driving a car, you have got 6 airbags. You don't want them to be used.
Yes.
But in back of your mind, you know that if something happens, there is a protection.
Yes,
and
exactly.
safety. Same thing I would say for robotic surgery.
Understood.
And it will take away the surgeon's, human errors. There's a lot of safety mechanism. And again, I would say that robotic system, which is very, very safe today, I'm sure tomorrow it will be even safer than what it is today.
Yes, we will talk about the what is next for India and the world. So मेरा एक question last, अगर financial को लेके मैं बात करूँ तो ये रहेगा that you are the group chairman of very big chain that is Max Healthcare. And if I talk about the other hospitals as well, sir, how many hospitals are like having the insurance of the robotic surgery? Like if the patient has taken the insurance, so you can just comfort the patient that you have the insurance, you don't have to worry about, because many of the patients feel like paise to hai nahi, chahta to main hu robotic karwana, but due to the money I can't do it. But we can rest assure them that you have the insurance, you can go for it.
Yeah, I think insurance companies are now paying. Previously, I think there was a mindset that insurance companies were paying robotic surgery for cancer patients.
Achha, okay, is it?
But but like it's very difficult, illogical that for you want a good surgery for cancer patients,
yes, but
not a good surgery for
other
common surgeries, non-cancer patients. But I think we are trying to make them understand that robotic surgery is good for cancer and non-cancer patients equally.
Yes.
And they're going to take some time, but I feel that there is no way the insurance company at the moment can deny robotic surgery. However, some denials are there, but I think the industry, all our hospitals, all group chain of all the hospitals, we are working that it should be like any other surgery, We have seen this way back 35, 36 years back when we moved from open surgery to laparoscopic surgery, which was more expensive. But see, where we don't talk about conventional surgery at all.
Yes.
Today, I think everybody is flying and taking the flight route to any destination.
Yes, exactly. Now,
not that the people are not traveling in train.
Yeah, they are.
They are.
Yes.
So anybody wants to travel, but they have the option, and it is affordable option, which saving time and safety of their travel, etc.
So the alternatives should always be there. It is totally up to the patient.
Yeah.
So if I talk about, sir, for example, a patient has come and you have just diagnosed so-and-so disease. Now you have given the alternatives. And the patient has given a little, you can say, thought to the robotic one, but still have certain doubts. How will you convince that patient?
Well, I think anybody who's receptive about it, we see in every day. So even if the insurance companies are not paying, they pay upfront because it's their body. And safety is important for them.
Yes.
The scars are important for them. The pain is important for them. So they don't bother what the insurance is paying.
Yes.
Insurance is paying for conventional laparoscopy is fine. But they do pay on their own.
Achha.
And according to me, I think it's a very wise decision.
Yes, very wise.
Because nobody is more concerned about your body and your health than anybody else for that matter.
Yeah.
So I feel But sooner or later, I think it will be order of the day. In maybe conventional surgery, laparoscopic surgery will recede in the background,
Yes.
and robotic surgery will be the standard
Yes.
management criteria.
Yes, fear to confidence का भी जर्नी चल रहा है और अभी इसमें बहुत चीजें आने
Yeah.
बाकी है.
I like that fear to confidence. I think it's very interesting, and it explains and says all. I think what we have been talking.
Yes,
about.
exactly. Now let's see, sir. आप अभी बात कर रहे थे कि अभी पता नहीं और क्या आएगा. Like when we will be having another podcast in the future, you will be talking about last time we talked about so and so.
Yeah.
So if I talk about the future, what's next? Especially I talk about the India right now because we are in our own country. So what do you see, sir, in the next upcoming years? Like, as you said, that AI is doing tremendous. They are just making the whole procedure so precise, so you can say safer. So what do you see the next future of surgery?
Well, I think next future of surgery first will be robotic surgery.
Understood.
May it be abdomen, may it be chest, may it be heart, may it be eyes, may it be joints. Everything will be robotic. So I think we will soon reach to that stage.
Understood.
Because and the diagnosis, the endoscopes, etc., they will all be robotic assisted endoscopes. So this revolution you can't hold back.
Yes, yes.
It is going to be there. There will be many more players. Many more platforms
Yes.
will come. Many more companies will come.
Yes.
So I think the cost will definitely go down with competition.
Exactly. Thus resources will be more. And then if the resources is more, the price will definitely come to the...
And the numbers will go up.
Yeah.
So that will definitely bring it back. But I think today, if we are opting for robotic surgery, I think we are making a very wise decision. And gradually the number of hospitals also are increasing who are acquiring the robotic systems and acquiring the robotic surgeons, skilled robotic surgeons, trained robotic surgeons,
Yes.
trained robotic technicians and operating team. So that is happening, which we see. Couple of years back, we had a very limited number of robotic installations. Today, I think Da Vinci itself is maybe 300 plus
Yes.
systems, and every year they are increasing.
Yeah.
And the new generation of robotic systems will come.
Yes, definitely. So I think from your statement, I can just bring up the crux that robotic is the biggest opportunity for India in the future. Yes. And sir, as you are the group chairman of Institute of Laparoscopic, Robotic, Bariatric, and many more, GI surgery. So how important is this now for the doctors to cope up with the technologies, make themselves trained for the robotic? How much confidence and how much opportunity you are looking for the doctors?
Well, I foresee that there is not going to be any option.
Okay.
You have to follow.
Yeah.
I don't think there will be an option. Like there is no option previously that a conventional surgeon has to do robotic laparoscopic surgery. So now I think all laparoscopic surgery, they have to move on to the robotics.
Yes.
Maybe diagnostic, maybe therapeutic. And now India is making robotic system.
Yes, exactly. Make in India.
Make in India. So that again a big boost for the robotic systems availability in the country.
So how do you see the current scenario of the infrastructure if I talk about the robotic ones?
Well, I think we have done quite a bit in this direction. The Indian robotic system has progressed very well. And I'm sure many more entrepreneurs will enter into this field.
Yes.
The softwares are easily available now. The hardwares, the pulleys, the strings to pull the instruments, etc., is available. So I think now is almost like an explosion.
Explosion.
And added by AI, it multiplies.
Multiplies
the progress,
that. Yeah.
shortens the duration
Yeah.
of the new generation coming up.
So as you are the I will definitely call you now as the master of robotic surgery, sir. So if you see the awareness about the robotic surgery, how do you see the current scenario of India? How much awareness is there in the society? Do you see that there is a lack?
There's quite a bit of lacking, but I think this is mostly because of lack of knowledge. And I think we have clarified that it is not the robot who is operating.
Yes.
So they think about the robot waiter in the restaurant, robotic, that
Yes,
he's
sir,
coming and
nowadays.
distributing it.
Yeah.
So it's not true. And we have to understand that this is a slave robotic arms.
So I think first we have to rephrase the word only, sir.
Correct.
If we rephrase the word itself will tell the real meaning of that thing.
True.
Yeah.
True.
So for the awareness, what do you suggest for the society, sir?
Well, I think you should understand that robotic surgery is just a technique of operating safely with more accuracy and more safety features available. That is what I would say. And another thing which I would say is that the training of robotic surgeons are far, far more as compared to the laparoscopic surgeons who wants to move to robotic. So the day is not that they buy a robotic system and start operating. They have to qualify.
Yeah, okay.
So something like if you are driving a car and if you want to fly, you have to have a pilot license.
Yes.
From one model, when you go to another model, you have the endorsement of the new aircraft.
Yes.
So it's a very strict sort of thing. So when you sit on the robotic system, you have to log in your name and there is your password.
Okay.
That who is operating.
Understood.
So once your name is there, you are responsible surgeon.
Yeah.
Then you log in. So nobody can log in, just like your bank balance.
Yes.
So once you are logged in, then whatever you do after that, you can't say that I have not done it.
You are the whole soul responsible of
For that. It's a huge responsibility.
Yeah.
It's not that you just open a door and slide yourself under the steering wheel.
Yes, understood, sir. So I think now in the future, the robotic surgery will become as a routinable thing, like as we do the surgeries nowadays. So it will become in our roots and in our routine. So now if I say one statement, sir, कि बहुत लोग बोलते हैं that in the future, the surgeon will not command the robots, but the robots will command the surgeon. How do you see such kind of statements when it comes to the Google?
No, it's a wrong statement to me. The surgeons will never be replaced.
Yeah.
The robotic system will improve.
Yes.
Right? But the surgeon will always be there because every human being is different. The anatomy is different.
Yes.
Everything is different.
Everything.
But yes, we will be guided. For example, Google guides you.
Yes.
What route you have to take. Where is the congestion? It will show the red. We should show the yellow color. So robot will tell the surgeon, these are the dangerous areas. These are something, it's like that.
Yes.
So surgeon will always be there.
The whole soul controller of 100%. The whole procedure.
And also responsible person.
Yeah.
For that completion and clinical outcome of that patient.
So basically, if I say one statement out of yours is that AI or the robotic arms will assist the surgeon to make the best decision. Yeah. Understood.
And it will be better assistant tomorrow than what it is today. Because of the technological improvement.
Yeah. Understood.
Impregnation of AI and, changing technology, which is so quickly changing.
So do you see, sir, that robotic surgery will make everything very accessible? And maybe in the future when new companies will come up, new resources and new infrastructure will come up, definitely it will make the affordability for the patient who are not able to get it right now.
Well, this will become standard. And of course, the per procedure cost will dramatically come down. The capital investment also will come down because the number of installations. So I'm sure everything, to me, it looks very bright.
Very nice.
And I don't think there will be any possibility of inexperienced, untrained surgeon doing robotic surgery at all.
Yeah. So my last question to you, how do you see the kind of misinformation pool which has been created over the social medias are not only making the people, I will not say it as a patient, making the people more discomfort and more like not having the faith on the surgeon?
Well, I think, the media, if it is social media, by and large, I would say there's a lot of negativity,
Yeah.
and negativity travels very fast.
Yes.
And people make all effort to put a negative comment. Nobody will think about what
The
it has
outcome
done,
will be, yes.
what outcome. And nobody feels responsible that one negative comment can take away so many positive things from a particular
Yes.
technology.
Yes.
And there may be some malified intention also that somebody will say कि जितना डिले कर सके हम रोबोटिक सर्जरी को एंटर होने के लिए
Yes, yes.
उतना अच्छा है.
Exactly.
It's just hanging on to it and talking about something which is not favorable.
Yes, but changes is the rule of the universe. बोलते हैं ना कि परिवर्तन ही संसार का नियम है.
जी.
So we should always follow what the universe has brought to
Yeah.
us. Exactly.
And I have seen it so many years back when conventional surgery से मैंने लेप्रोस्कोपी शुरू किया, तो हर आदमी बोलता था कि ऐसा, वो तो सर्जन बोल रहे थे कि ये ओपन करके बढ़िया सब दिखता है, अंदर सब कुछ दिखता है. तो आई यूज्ड टू आस्क, दैट रिमाइंड्स मी, मैं बोलता था जब आप एयरप्लेन में जाते हैं रात में, आप फ्लाई कर रहे हैं, तो एरोप्लेन को नीचे तो कुछ दिखता नहीं है कि कहाँ पहाड़ है, बट देयर आर गैजेट्स टू टेल यू व्हाट हाइट, व्हाट वेदर, व्हाट टेम्परेचर.
So basically we have to be optimistic
Yes,
and very hand on hand with the technology.
Absolutely.
Yeah.
Absolutely.
So one message you would like to give to all the new surgeons who are coming to this noble profession, which we call it, and to the surgeons who are already there, and to the patients to make them the kind of confidence they want to have while going for the procedure?
I will say young surgeons and not also so young surgeons that this is a technological revolution. It will come. If you are with it, you will continue your journey. And if you're not with it, then it's a matter of things, you may perish. So the technology, you cannot, in modern world, with a modern communication, information system, you can't hold on it for a long time.
Yeah.
The best thing is get onto it, learn, train yourself, qualify yourself, certify yourself for robotic surgery, and get good marks on the simulators. Spend more time on simulator. And once you have acquired, I would say that after thousands of surgery, even today, many times I feel like going on a simulation.
Okay.
I go on a simulator because it's inbuilt there.
Yes.
So you go on a simulator, some very, very complex step you would like to repeat yourself, though you have done it hundreds of times.
Yeah.
But you want to
recheck again and again. Yes. So that's a confidence you want to build into yourself.
And that is a tremendous advantage.
Yes.
You don't have to look for the patient.
Yes.
The simulator is there and you simulate, and every day you keep on polishing your skills. Yeah.
And one message for the patients who just want to go for the surgery but having some kind of negativity inside their mind.
Well, I think if for any professions, I say choose your profession. If you are professional, if you need some doctor, go to a specialized doctor. If you need a good legal advice, go to a good legal expert. Once you go to the right person, then try to follow what he's saying.
Yeah.
If you're not able to understand कि आपको नहीं समझ में आ रहा, ask 100 questions.
Yes.
है ना? Unless you are convinced. And of course, then I'm sure you will be able to take the correct decision.
So like,
rather than getting confused, don't follow the WhatsApp, don't follow the WeChat, don't follow into all those
social media platforms. Yeah.
It will never give you the correct answer.
Understood.
The experience of a doctor, professional for that matter, is very important to tailor your treatment plans.
Yeah.
And how he's going to, it's a chessboard.
Yeah.
How we plan the moves.
Yes, exactly.
We cannot be given by any other method.
Yes, exactly. And like I said during the podcast, sir, that before choosing any of the procedure, first choose the right surgeon who can guide you, who can make you as healthy as you were. So thank you so much, sir. Today we discuss a lot of new things from the person who has seen the timeline and the evolution from the traditional to the robotic. It was our pleasure to host you, and we are looking forward to so many new technologies which will be coming in the future, and which sir himself will be doing so many things in the future. Thank you so much, sir, and pleasure having you at our podcast. And thank you so much for the Healthy Talk show. And our viewers, we will definitely be bringing up a lot of new activities, a lot of new insights from the person like Pradeep, sir, so that you, whatever you are having inside your mind, those things will be erased and new optimistic and positive things will take place in your mind. Thank you so much for having me.